Dr. Semby, naturopathic doctor. I work at the Center for New Medicine. What we are doing right now is using Endolaser, and we are doing what's called photodynamic therapy. It has shown to be very effective in precancerous and cancerous lesions, especially if it's squamous cell carcinoma or precursors to that. We've been treating our patient now for several weeks, and the before and after photos will show the difference that we've been able to make. What I'm using right now is red, blue, green, and infrared lights. And we focus on the area. Is this okay? Or too long? Okay. We focus on the area, and the distance from the skin is based on really patient comfort. We try to be not too far. We want to be close to the skin, as close as possible without causing too much discomfort. If there's a little bit of tingling and warm sensation, that's okay. We do want that. So these lights, the green and the blue, are more surface lights. They don't penetrate so much. They only go like about 1 to 2 millimeters in the skin. But they are antimicrobial and anti-cancerous. The red and infrared can penetrate deeper, so it can have an impact on the disordered or diseased cells under the surface. What our patient is also using is a photosensitizer and an anti-tumor cream called ALA mixed with DMSO to help it penetrate the skin. And so he puts it on 3 hours before we do this treatment, because that's how long it takes for it to be activated. And then we wear these goggles to make sure that we're not looking at the infrared and red lights directly. So the treatment is about 20 minutes, and we can choose the intensity of the lights all the way from 0 to 100%. So when we started out, we started at about 50, and then we would see based on his comfort. And as he was able to tolerate more and more, we ramped it up to 75%, and now we've been doing at 100% for the last several treatments. So what we do is we just move the laser slowly across the area, and the key is to do it consistently for over a period of several weeks. The before and after photos will show what a difference this has been able to make, but we did it for about 20 weeks, 20 treatments over.
At least.
Yeah, we did at least 20 treatments. So the before and after photos will show you that it took 20 treatments to get from point A to point B. But your experience was interesting, right, Trent? Would you share, like, when you first had this lesion come up, you went and had a Mohs procedure, is that right?
Yeah, actually it started out as something about the size of a little fingertip, and it's sort of sensitive, a little bit kind of edgy, if you will, and it kept crusting up. And so I went in to a normal dermatologist, and he took a biopsy, and they turned the biopsy in, and they said, well, you have what's called a squamous cell carcinoma, which means it's a little deeper, it's not just surface, and they recommended what they call a Mohs procedure, named after the person that came up with the process. And then, so I scheduled and went in for that. The way the Mohs procedure works, if you're not familiar with it, is you go, it's an outpatient, you go into the doctor's office, he outlines the area, and then he makes an initial incision, hopefully with the boundaries wide enough and then going deep enough that he gets all of the cancer at the first shot. But they immediately take that sample into a lab while you're waiting there, and they actually dissect it, look at it, and then tell the doctor whether it's good the way he's done it or he has to do more. And as mine turned out, it wasn't deep enough in the center, so he went back and actually had to go deeper in the center area. And my take is that that was probably not the way that it should have been done, because when he went back the second time, he was just concentrating in a small area. And I'm pretty sure what happened is that once he had made that initial incision, the cancer cells migrated immediately to the adjacent area. And then when they were done with it, it was a healing process, and the different bandages that went on for like 6 weeks, and allowing it. And at first it looked like everything was going fine. Unfortunately, what happened is around the outside margins of the Mohs, which were probably, I'd say, about 3/8 of an inch diameter and kind of oblong, it started growing again, and it was much worse than the first time around. And so the initial pictures you'll see will show the condition it got to. I would say probably within 8 weeks to 10 weeks after the initial Mohs procedure. So it was a failed Mohs procedure. And then the actual doctor who did the procedure, when I showed him the pictures, and it was remote, actually he's up in Reno, he said, we shouldn't do another Mohs procedure. Instead, we should get some kind of radiation treatment on it. So with that, that's when we came in and saw Dr. Keneally, and she suggested that we do the Endolaser on it. And we were agreed because we didn't want any more invasion surgery here, potential spread, because it gets huge. They have to cut out a section like this, and this is a really bad area because there's hardly any meat there, so to speak. And so anyway, thank goodness this has worked. Dr. Semby, she's been fantastic. So I can highly recommend this. I think mine was probably an unusual degree to catch it late. It was it was really advanced.
Yeah.
And I've got another little spot on my side that I'm convinced it's the same thing. It's hard for me to see, but I can feel it. It's about the same size. It's behaving like this. So next time we'll start working on that treatment.
Yeah. Yeah. When Trent came in and Dr. Keneally called me in to look at the lesion and talk to him about photodynamic therapy, he said, like, whatever options are there in the conventional world, they will still remain. If we still have to do something, we can, that remains in the world of possibilities, but we should give this a shot and really try it. And it has turned out to be successful. So we are very happy with the outcome here.
Yeah, personally, I think this would work on a lot of the, probably the surface cancers that are obvious, upon survey without having to do a biopsy. The biopsy, I mean, we're just cutting away part of your anatomy, sending it in, and hopefully got all the margins without having to come back again. But if you could use this, then it's non-invasive. It just deals with it. The body, once the cells are dead, reabsorbs it, and you don't have to deal with the potential infection and just all that goes along with surgery.
I think the key is to take early action.
Right.
The earlier you are cognizant of what's happening and come in for photodynamic therapy, the better it is. And non-invasive. It's just you have to make a commitment to coming in regularly and doing the treatments. What I've also been noticing success with is things like dermatitis, acne vulgaris, like really, really excellent results in shorter time. So it really depends what is the underlying condition and how much work needs to be done. So that's it basically in a nutshell. If you're interested in finding out more about photodynamic therapy. Call our office to schedule an appointment. You can talk to me for information. You can do a quick 15-minute session just to answer any questions you might have before you get started. So we're here to help you.